Zoom to YouTube. Okay, so we are now recording. So I left off on Monday, just we were talking about cognitive development with infants. Specifically, we were looking at some of the theories as far as how memory works. We were looking at how we were kind of fitting in John Piaget's cognitive development model, specifically the stage one, the sensory motor stage, where children are starting to explore their environment around them through sensation, either through touch, through taste, through whatever. You know, they're very dexterous. They like to hold on to things. They put things in their mouth to start to develop how things work and how things are shaped and how things feel. And that kind of just builds. And I think I relayed to you how Jean Piaget really coined the idea, the concept that children are little scientists, they're little explorers, and that holds very, very true. When their minds develop, they're primed and poised and ready to acquire information in some fashion. And we're going to see a little bit of that in how they start to develop their language abilities earlier on. And these are, of course, in their infancy stages, right? While they're infants, but they're starting to build. They're starting to put these building blocks together so that they can fine tune them a little bit later, so that we can be well-spoken, well-thinking, and well-remembering adults. But the foundations start much earlier on. So I'm going to share my screen with you here, just so you can kind of see and read along with what I'm showing. So this is the slide that we left off with memory. And if you remember, if you remember that memory is really, it's a concept, okay? We don't have a way to really track the electrons or track the impulses that are going through our brain from sensation to memorization and then recall. In fact, the only way that we can ever gauge that memory has occurred is if we can observe it through learning, or we can get some kind of feedback verbally. And that could look in very much in the form of telling somebody a story and having them comprehend that, because we can't really tell comprehension until they feed back. They give us some kind of verbal feedback as to what we had relayed to them. So it's a very complicated, convoluted process in trying to determine how intelligence is gained, how memorization occurs, how learning occurs. And it's through observation and listening and watching, okay? So very important to remember that. So, and when we left off, we talked about one of the theories, the information processing model, how information is brought in through the senses. It's buffered in some way that it's assigned importance, and then based on that importance, we rehearse that in a short-term memory. And depending on how much we rehearse it and how much we use it in our everyday life, that might go into our long-term memory so that we can retrieve that later. And that seems to be the most popular model, of memorization and recall. Okay. In respects to language, excuse me. So one of the other, well, we talked about a little bit of the cognitive neuroscience of memory, looking at the two separate systems that are involved with the long-term memory, which is explicit and implicit memory. And really the only takeaway that you really need to have with explicit and implicit memory is, did it happen to the individual, or is it something that was told to the individual? Okay. So for example, if I asked anybody in this, the Zoom room, what is the capital of Pennsylvania? What would your answer be?
Harrisburg.
Harrisburg, that's right. You better know that, right? Now, there are two reasons why you know that. If you're not from Harrisburg, somebody had told you that. If you are from Harrisburg, then you know this because you have the Capitol building. Many of you have been to the Capitol building. So the reason I like to use this is because we really divide this in two camps. Either we were told this Like we've lived in, or we've never lived in Harrisburg, but somebody told us that Harrisburg was the capital, which is explicit memory. And then we have implicit memory, which is personal knowledge of something. Okay, so many of you might have personal knowledge of birthdays, right? You might know your parents' birthday, or your kid's birthday, or your siblings, somebody's birthdays. Those are because you have been involved with those events. So those are implicit memories to you. Now, if you told me that your parents' birthday, your father's birthday, for example, is October 30th, whatever, that would be explicit to me. So hopefully, really, that's the only two takeaways that you need to have with explicit and implicit memory. Is explicit is it happens outside of you and you're told that information, and then implicit is something that you know firsthand. Okay. And children at a very young age, they tend to lack the explicit memory. They're not they may be told things, but they need to experience it first. So a lot of weight is placed on their implicit memory because they're exploring, they're starting to understand things at their level and their sphere of knowledge at that point. And as they grow a little bit older, they're able to acquire a little bit more information externally because somebody told them. Okay, so it's very important to remember that.
Wouldn't the birthday example, is that, but wouldn't that be explicit memory in the beginning when you're a child, you learn this day is my father's birthday, and then it just becomes something you always know, but originally you learned it explicitly, right?
Well, it depends on the experience that they have, because we start to really grasp what a birthday is by having birthday parties and celebrating those. So it would be more implicit if it's something that's celebrated, and then they understand what birthdays are, and then they can start to understand, well, hey, yeah, it's that other person's birthday. It's my distant cousin's birthday or my teacher's birthday or something. Even though that they weren't part of that event, they understand what a birthday is. So you may be right if they haven't experienced that birthday, but usually the most salient memories come from something that they explored, that they experienced themselves. Does that make sense?
Mm-hmm. Yep.
Okay. So going back to what earliest memories and how they occur, we estimate right around, I think we talked about this on Monday, we estimate that it's right around 3, 4, 5 years of age that children really start to develop their earliest memories. And there are a couple of theories as to why that may happen, because they could be just learning the language and understand the world around them. And we do think in terms of symbols and words at times. So if we haven't mastered the language, then we really perhaps haven't been able to commit anything to long-term memory to retrieve that much later in life. Now, some people report that they have memories of much earlier than 4 years of age. And I'm not here to say that they're incorrect, but it's highly improbable. In fact, there are probably, as a psychologist, there are a lot of explanations as to why that could occur. And one of those reasons are false memories. We can adopt memories. We can form memories in our head just based on stories that people have told us. And somebody that has a very creative mind or artistic mind might be able to do that. So yeah, and again, I'm not here to debunk if any of you say that I have memories prior to being 3 or 4 years old. That's completely just out of curiosity. Does anybody have memories that they think that they've had before 4? Usually, sometimes I get at least 1 or 2 in the class, and it's fun to share those. But anyway, I always look at alternative explanations.
Yeah,
Yep.
I have memory when I was 3 years old and I used to sit with my grandpa,
Mhm.
and he died before I was 4 years old. So
Okay.
I could still remember I used to be with him before his
Okay.
death. Yeah.
Okay. So you have memories of his face. And now I'm just
Yeah.
curious, were you an early speaker?
No, I was told I didn't speak until I was 2 years old.
Okay. Okay. You until you were 2 years old?
Yes.
Okay, all right. Well, that's about on par. So yeah, and again, that's probably within the threshold of three-ish, 4 or 5 years of age. So
I just can remember he used to sit on a sofa and I would sit beside him. So I could still remember that.
okay, okay.
Yeah.
Uh, and that's totally within the realm of possibility, that somebody at 3 years old might remember something like that because you at that age you are remembering faces. So much earlier than that, actually, right around 1 or 2 years old, we start memorizing faces and start learning expressions that way. Okay.
Okay.
All right. Well, thank you for sharing that. Let's see what else is on explicit memory. Yeah, let's see. I think I covered just about all I wanted to with that. So let's talk about intelligence. Now, intelligence is really a buzzword, okay, that we use in psychology, that we use in developmental psychology to estimate what an individual's adaptability to their environment is. Now, you're going to hear intelligence in the context of many things. Like, for example, what is what is probably the most popular way that we measure intelligence? Do you think?
IQ.
IQ, intelligence quotient, absolutely. So we use, most popularly, we use an IQ scale, and 100 being about average. Well, it is average, being 100 percentile, which is right down the middle of the road for intelligence, for people that have tested similarly in based on age, based on, it used to be based on sex. I think they've modified it. At least the WISC-5, I believe, is modifying that. But it used to be based on age, based on sex, and in some cases, depending on the scale, they might base it on your education level, like the Woodcock-Johnson test, which measures certain achievements. So anyway, intelligence, we've really adopted these scales to estimate what individual's capabilities are, or disabilities are for that matter. So looking at infants, it tends to be problematic because we don't have necessarily a way to communicate with them other than observation. Okay. A big portion of what we do with intelligence testing is based on communication. How many numbers can you remember? How many words can you remember? What is your vocabulary level? Can you follow instructions? There are some parts that are based on observation and creativity and how we can manipulate things with our mind, but those are also based on instruction. So a child that doesn't have good language abilities will not be able to really follow these instructions. So we had to adopt other ways to kind of gauge how intelligent kids are. And but just keep in mind that any intelligence test is based on norms and averages. So they look at a population of children and take that sample and try and figure out what kids that operate at a normal level and grow up to have normal lives. Based on that information, there's previous observations, they put that data together and try and estimate if a child is either meeting those thresholds, exceeding those thresholds, or fall short of those thresholds. So those are some of the challenges that we encounter with trying to establish intelligence of children earlier on. But nonetheless, we do have a pretty good grasp on whether children are meeting those milestones or they're not. And if they aren't, that could be indicative of certain issues that we might need to watch out for, either earlier on or later on down the road when they get into school age. All right. So some of the approaches that we use to look at differences in intelligence. We have the developmental quotient, we have the Bailey scale, and we have the visual recognition memory measurement scale. Okay, so these are three things that we use. Just to kind of go through these quickly. The developmental quotient is just looking at certain domains. It's looking at certain motor skills, like are they able to sit upright? If we place a child upright, are they able to maintain their balance based on a certain age? Prior to 6 or 4 months old, probably not going to see a lot of movement there. But when we get into about 6 to 8 months, we should start to see them at least stay upright for a good amount of time before maybe falling over. But if they're not, that could indicate some kind of vestibular issues, like maybe they have some kind of balance issues, or maybe they're not feeling well. Okay, they could have colicky, for example. They might be more comfortable on their backs or on their sides. Language use at a certain age, we should start to right around 8 to 16 months. We should start to see at least babbling occurring. Okay, if not using single word or single syllable words at that point, we might start to see that. They may not comprehend it, but they should at least be able to replicate it right around those ages. And of course, as they get a little bit older, I think I have a chart in here that shows, sorry, I know I'm flipping through a little quicker. Yeah, I do. So it's a little bit later. So I'll kind of go through what those language abilities are a little bit later. Adaptive abilities. This is where you might see the doctor snap at his fingers to see how alert a child is. So back and forth and seeing if the child can track what he or she is hearing. And likewise, might have a light pen to see if the child can track with his eyes. And again, if we're not seeing that, there might be some kind of disability or some kind of skill that they might be lacking. Okay, so that is something to watch out for. And then personal social behavior is how do they respond to other people in the room? Are they excitable? Are they adaptable? Or are they anxious and crabby when either a mother leaves the room or whatever? So these are all things that we look for as far as the developmental quotient. The Bayley scales of infant development, very similar, but they really focus on 2 areas. They look at the mental abilities and they look at motor abilities, motor capabilities. Okay, so fine and gross motor skills. Are they able to grasp things and manipulate it and do things with it, or do they just tend to sit there and look at it? At a certain age, right around 4 months of age, we should start to see them holding on to things, that pincer clasp ability, being able to grab onto things and hold on to it. Okay, they may not manipulate it and do anything with it at that age, but right around 4 months of age, we should see those abilities. And then, of course, mental abilities, very similar to what we saw in developmental quotient. Are they able to manipulate things like blocks or toys at a certain age, so on and so forth? Language ability comes much later. Visual recognition memory. This is a little bit different in that it does not really, I don't want to say it discounts their motor capabilities, because it does look at them, but it really focuses on, are they able to remember things? And again, it's not a matter of remembering that we're able to track, it's how they retrieve it. Okay, so we may, for example, we talked about object permanence with Jean Piaget's first stage of sensory motor stage, right? With object permanence, is the child after about 6 months of age, are they at least able to start seeking out that item? So if we hid an item under a blanket for a child, are they going to look for it? Okay, so that would be an example of looking at memory and gauging whether or not they're able to remember things. Okay. All right. Let's see, we talked about both of those, so we can probably. All right. So just to give you kind of an idea of some of these abilities that we look at, especially with the Bayley scales, because remember, there are 2 scales that we look at. We look at mental scale and we look at motor scale. So right around 2 months, we should see one of the milestones that we should see children have is turning their heads, snapping. This is oftentimes when you see the doctor snapping his or her fingers to see if the child is tracking in either ear and turning their heads to look at it, or are they looking, being able to track a finger or a light or whatever, something that whatever the doctor is asking to track. Okay. Right around 6 months, we should start to see them grasping things and picking up things and starting to manipulate things a little bit more with their well, not only with their motor skills, but as far as their mental abilities to try and do something with that. Pick up things with purpose, I guess, is the term that we should use for that. And then right around 12 months, they should start to build things. We would see that in the form of constructing a tower out of blocks, for example, or being able to place certain items in like a round hole or a round peg in a round hole, for example. They should start to manipulate and start to figure that out right around 12 months. And then right around a year and a half, which is about 17, 18 months, we should start to see them recreate objects using crayons, chalk, whatever, maybe even paint. And then right around 2 years of age, they start to develop their memory skills where they're able to pair up pictures and they might be able to mimic certain words, okay, and assign meaning to them. That's the big thing, because we all have maybe either observed children that are able to pronounce things like dada or baba or mama or something. But what does that mean? Right around 2 years, they should start to really understand what these items are. They should understand that baba means something to drink, because children at this age, they should not be parrots. I'm sorry. They shouldn't be just repeating words nonsensically. They should have meaning at this point and be able to replicate them when it's an appropriate time to do so. And then right around, right around 3 years, a little over 3 years of age, they should be able to identify at least 4 colors. And they should be able to remember things that had happened in the past, remember those implicit memories, being able to either recall or not necessarily recreate, but be able to pick out of a lineup of items that happened in the past. Like if we asked a child, what did their brother get for birthday, and they should be able to say truck or something like that. Okay. So that's really, and again, right around 3 years of age, that's when our memories really start to develop into the more sophisticated memories that we have today. And right around 4 years of age is where they start to really pick up on those historical events. Okay. Excuse me. As far as motor scale, the motor skills that we look at in the Bayley scale, and this is the Bayley is probably the most popular one that you'll see used with physicians and developmental psychologists, just because of its simplicity. It's widely used and it's very easily normed. Excuse me. All right, so right around 2 months. And we're going to be looking again at the motor skills, and we talked about that. Are they able to hold their head steady? Are they able to sit with a little bit of assistance, right? They should be able to at least do that, and then before they topple over. And then right around 6 months, that's when we're looking for at least sitting up straight for 30 seconds without falling over. Okay. Now there could be many things that affect this, and the physician usually doesn't live with the child, live at home. It's very uncommon for that to happen unless one of the parents is indeed a doctor. So there could be many reasons why that child at that moment isn't sitting up straight at 6 months during their 6-month well baby checkup. It could be they may have a tummy ache, or they could be imbalanced some way. They could have some kind of head cold that's affecting their vestibular senses. So it's important to kind of just understand that, because if a child at a well baby checkup at 6 months doesn't perform some of these functions, yeah, it might be worth noting, but it also might be worth maybe doing a follow-up exam in a week or two, just to see where that child is. They should also be able to grasp things with their foot, that if touched on the sole of their foot, do their toes curl? Are they trying to grasp things with their toes? If something is placed in their hand, do they wrap their fingers around it? That should be happening about 6 months of age with reflexes. And right about a year, that's when we're seeing children walk. Okay, at least with assistance. So they may run from one couch cushion to another, but we're not going to see the fine motor walking at 12 months, but they will be absolutely able. They should absolutely be able to be upright in some fashion, either with assistance or not. And then right around a year and a half again, standing on one foot without help. Okay, climbing stairs with assistance, of course, and then right around 2 years, being able to put things together. We're going to see this finer motor skills take place, where they're able to use their pincer clasp between their finger and their thumb to hold things and manipulate them. Okay. And then right around 3 years, we could see them start to develop their finer motor skills with drawing and recreation that way. Okay. All right. Let's see if there's anything on here. So one of the things that we look at with the IQ test, and again, at a young age, it's very, very hard to come up with a formal IQ score. Okay, we can get a ballpark based on how the child is developing, how they're speaking, how they're recreating events through their words, or being able to remember where something is. So we have a ballpark figure about where they are and their capabilities. However, fine tuning that IQ is very, very difficult. One of the things we do know about intelligence is it never necessarily goes away. Okay, so if a child has a lowered I don't want to say a lowered intelligent, but if they tend to score a little bit lower in performance with intelligence earlier on, we're going to probably see that pretty consistent through their lifespan. Now, what does that mean? That doesn't necessarily mean if they get a low IQ score that they're not going to be able to function. That's not what I'm saying at all. But if, like for example, if a child is much later talking, and that could happen in various forms too. I've seen children that don't really talk much until they're about 2 years of age, and that could be cause for concern. But then right around 2 years of age, the floodgates open and they're just talking in complete sentences. My daughter was a great example of that. We were really concerned about her talking ability because she wasn't talking much at all up until about 2 years of age. And because she had an older brother that talked plenty, so she didn't need to. But after about 2 years of age, she just started talking in full sentences. I mean, it was actually remarkable. And she's quite intelligent even today. But that would be an example of where we might misdiagnose somebody, right? If they're not performing at a certain level, but then they catch up later in the back end. Okay, so that's why we say there's quite a bit of variance with children. But on the whole, children that show either superior intelligence, average intelligence, or lower ability intelligence, younger in age, tend to be pretty consistent throughout their lifespan. Okay, and we definitely see that with children as we get into like the the later toddler and preschool age. Children that measure at a certain ability tend to be consistent throughout their lifespan. Okay, unless something happens. There might be like an organic issue at their brain, there might be disease, there might be trauma, something that occurs that might take away that ability. But usually we don't see much gain in ability, if that makes sense. Okay. Has anybody experienced that? I'm just curious as to if anybody either had experiences with children that they were diagnosed or not diagnosed, but estimated to have higher abilities or something.
No, no high ability. High ability, like my daughter was in school examinated, and then she was they put in another class because she was so high that she cannot be there. They don't jump her, but they add another teacher one-on-one. I forget the name right now. A special student something, but
Okay.
she qualified because she was more than 121, whatever the questions was. She said it was a lot of puzzles, mom, and everything like that. And she was a student like that. And then my kids, they always by the age of 1, the doctor sent me to a therapist, speech therapy, because my kids don't have enough vocabulary. Well, the problem with my kids is that in my house, I speak Spanish. Outside, I speak English.
Okay.
Sometimes. And they don't know which one start. So I let my kids, if they see the English, but speak English.
Okay.
And immediately they was talking. They always, by the 7 month, they already walking. By the year, yeah, and I say, what did the doctor say? You don't have enough vocabulary. They do a little Spanish, a little English. When the therapy comes, they find they have words in Spanish, they have words in English, that is enough.
Okay. Okay.
I
So
feel like that's also, sorry,
Go ahead.
I feel like that's also a really common issue with CODAs, children of deaf adults, because their parents are signing to them, they're not verbally speaking to them.
Right.
And then they get to their well-child visits, and doctors are very quick to try to diagnose them with like ASD, or be like, your child is delayed, because particularly in the US, if a child is not communicating in spoken English, they are quote unquote behind. They are quote unquote delayed, because they're not communicating in the way that is necessarily socially acceptable.
Right.
So like for you, Josie, for you and your children were communicating just fine. They weren't communicating solely in English though. So these children and their parents are being told, oh, they're delayed, they need to do X, Y, and Z to catch up. And I feel like putting that perspective on it and putting that label on a child when their communication isn't delayed, it's just different. I feel like that's more harmful than it is good.
And then my husband was born and raised in New York, so he was completely bilingual, but he always talked to the kids in English.
Okay.
Yes.
Yeah.
And I had to learn English by the time I moved to Lebanon. But I say, why they always say that? And then when I started studying psychology, I understand a lot of stuff.
Yeah.
Even with my daughter that have HDAD, they say my daughter's intelligent, and they said she don't need help because she was A+ in the school. But she was behind in other areas, and then I start fighting for that, and finally she's fine right now.
Yeah, yeah, and you both brought up some really good points. There is not only cultural differences, but what do we do? What do we do with that information when a doctor tells you that your child is behind in certain milestones? Because folks, I'm telling you, we are just scratching the surface as far as understanding different cultures and how they really the importance that it plays on development in the United States today. Okay, and I use United States because that's where we live. That's the system that we're most familiar with. But what happens when we bring children from a different culture, or like you brought up, if they have two parents that are difficult of hearing, right? They may not have that ability, and that child that's not grown up in a verbally rich environment, still they may be understanding language, but just in a different form, either in American Sign Language or something, ASL. Or whatever that may be. So they're still developing those languages, but a lot of some of our tests that we have that some of the older doctors are using aren't sensitive to those things. And you're right. I mean, that could be diagnosing, that could be prematurely diagnosing children with disabilities that may not necessarily have those disabilities. So it's kind of a catch-22, because we do want to see certain language abilities happen at a certain age, because we do know if they don't, they may never happen, or they may experience difficulties in occurring that way. Bilinguists, I think, are probably one of the most, I don't want to say, I mean, diverse, obviously, but probably one of the most, they have the higher ability to adapt to certain situations. Okay. And the proof in that is children that tend to be bilingual are able to think outside the box a little bit more, right? So we can kind of see a higher intelligence with children that are bilingual or trilingual, that grew up in different cultures, and they're able to assign different meanings. And why is that? Why do you think that is? Why does language have anything to do with thinking outside the box or intelligence? What do you think? Why is it that we push having a second language earlier on, like in middle school and in high school?
Well, I understand it will be, well, by social thing is better because you have a job supposedly with more money. But
Okay.
I think it's another way to help other people or communicate with other people.
Right.
Yes, is to learn another language, you have to be out of the box.
Right.
Completely. And my experience, I have to stop reading Spanish, watching Spanish to get in the English. And now I'm trying to learn Italiano. So
Okay. All right.
yes, I like to be like that, I don't know. My mom always say, if you have the opportunity to develop other things, make your brain move around, so
Yeah.
don't stop there. So that's why I always try to run a milestone more. And with my kids, I do the same thing. I told them, in high school you have different language. Just pick the one you want. Don't take Spanish because I show you Spanish. And
Yeah.
with my mom, so they take French. My son wants Spanish, so I leave it like that. But I can help other people. And sometimes I'm in the store and you can see this face very, very stressful because she don't know how to communicate with the other person. And then the other person knows she's Spanish. Instead, to help her is, pointing and, oh, if you don't speak English, get out of here, this is America, whatever. And then Josie get there and I say, can I help you? What do you need to say? And I do it, and you can see the faces of other people. Yes, it's still people outside helping me. So I think that's a good thing to do.
Absolutely. Yeah. And one of the reasons that we have to really track this and help children understand, because we live in a multicultural world, right? The world has really shrunken down over the past 3 or 4 decades, with the advent of air travel and internets, and really, just incorporating a lot of cultures into the United States, and people in the United States moving to different cultures, right? I mean, that happens more commonly than it really did 30 or 40 years ago. So being able to speak different languages is becoming increasingly more important. And at a certain age, it becomes more difficult. Usually right around 25 to 30 years of age is really the cutoff point where we see, and it's not impossible for adults who have never learned a second language to learn one at that age, but it's much more difficult because we become, I think I shared with you the 200 billion neurons that we have. Pruning starts occurring almost immediately, and then right into early adulthood, that's when we really get stuck in our ways. That's when we start to think in single terms and try and create these routines. Go ahead.
I said every person has to take an example. My husband was a Marine, and he went to Japan. He don't understand any of what Japan said. And then, yeah, you have the command, and then what you gonna do? You don't understand what they said. And he said it was very, very bad, but he finds somebody to traduce and everything, but it was bad. You're in the military, you have to do something, and then you don't understand the language. Right. I don't think that it has to be more preparation. I think so.
Yeah, and that's what we aim to do with our school systems is not only teach the language and solidify a language, and there are different schools of thoughts, but I think the most popular one is teach multiple languages. At least that's my take on it. Is I think it's increasingly important to help children understand different languages, because we have to reinforce what their primary language is, but at the same time we have to disconnect them from that and teach them alternative meanings to things, and that helps to create a well-rounded individual. Not only in their culture, but in their thinking as well. And we see that. I actually, weirdly enough, I was a linguist in the Air Force. And I had a friend that spoke 33 languages fluently. And I asked him, I said, how long did it take you to learn 33 languages? And his name was Clayton. His name was Clayton. So Clayton told me, he said, I just learned 4. So, and you think about that. I mean, he learned Chinese Mandarin. He learned German. And of course, we already had English, and then he learned Russian, and then I think Korean. So based on those 4 languages, he was able to spawn off different, because those are really the 4 root languages outside of Latin, that he was able to break off and start to really get more specific in whatever region he was in. You know, like for Romance languages, Latin languages, we have French, we have Spanish, we have Italian, we have Portuguese. You know, when you go into German, you have Romanian, you have Hungarian. You know, all those are more German and more Slavic. And then, of course, you get into Russian. You can speak Kazakh, Uzbek. You can speak Georgian, you know, but anyway, he just spawned off from each one of those 4 languages. So anyway, I thought that was really interesting that it just took him, because once you learn how to learn another language, awesome, then it just takes off from there, right? So anyway, I know I kind of got sidetracked there, but that leads me into our next point here, which is developing those languages. Okay. Let's see, assessing information processing approach. So just some of the, just to kind of wrap up how we look at intelligence and information processing. Some of the or some of the pros of it are it helps us to develop a more precise measurement into understanding what a child's abilities or disabilities are. And it gives us kind of a precursor, a marker to gauge whether or not we need to get them in a more learning rich environment, as opposed to just getting to that stagnation point where they're not, where they've maxed out their learning. Okay. And it could be misdiagnosed, which is one of the cons, is we might not get a whole picture. Like if somebody is raised in a house with the hearing impaired, it might be difficult to gauge exactly how intelligent and how adaptable and what language abilities that child has, unless they're seeing a specialist who is able to gauge that kind of ability. Okay. So to have a doctor that has good ears and probably able to understand languages and then diagnosing a child with a learning disability because they're raised in a house with hearing impaired, that could be a problem for that child later on, because he or she might be held back from certain opportunities that he or she was capable of doing. So that's one of the cons, is just making sure that awareness with the doctors, the doctors are up on the most modern medication or most modern medical practices, and cognitive abilities is very, very important. All right, so that kind of brings me into languages. Okay, let's see what time do we got here. Okay, so with languages, again, we look at this from a building block perspective, where they start to observe initially, right? Right out of the womb, children are listening and they're watching and they're trying to understand, because a lot of this is survival. They are eager, they are motivated to learning because they want three things, right? They want comfort. They don't want to lie in their messy diaper, right? Because that's painful for them, right? They want to fill their bellies because that's important for them. If they don't have food in their bellies, their stomachs start to growl and make some not so pleasant feelings, right? So they are motivated to figuring out a way to communicate that in some way. And of course, the third one is comfort. They desire comfort. They desire to be soothed whenever they want to be rocked to sleep or whatever. So those are really the three primary driving forces that get a child to start recording, start memorizing faces. Where's my comfort coming from? Where's my food coming from? What do I have to do to get that person's attention? And that's really at the root of communication, is attempting to gain something from their caretakers. Okay. You're going to hear, you probably saw in your book or some of the videos, infant directed and gender related speech patterns. Okay. I don't know. I don't think we really go into it with the slides here, but infant directed speech is just the ability to talk to children. We have this tendency to talk to children at their level, right? We tend to do goo goo gaga, right? Why do we do that? Does anybody ask themselves why we talk to children at that level?
Because it's encouraging that vocalization, and that's how they start to develop their speech.
Right. And to a certain point, it is helpful, and it's actually advisable to use babbling to promote children talking those very basic those basic skills, right? Where it is harmful is if the parent continues to do that. Like if the parent does not, or the caretaker doesn't learn or doesn't adapt to what the child's abilities are, then we could wind up with speech disorders, right? We could have speech problems later on in life. That child may grow up talking like an infant or a toddler for much into their, I've seen that happen into their adolescent years, okay, in some kind of regression of some sort. So infant directed speech is good to a certain age, and then we have to bring them up to what our language abilities are. And it's really the caretaker's responsibility to do that, help them develop those language skills, because they come prepackaged, ready to talk. But if it's not developed properly, it could lead to reading or learning issues later on in life. Gender-related speech. How many of you, does anybody have examples of like gender-related speech, something that might be gender specific?
I'm not sure if this is right, but I have 3 girls, and so by saying like, okay, girls, come over here, or time to pick up the girls from grandma's house or something, to me, I feel like I try to correct myself to say kids, because just to make it something that's neutral. Is that, yeah.
Yeah, that's a good example. We also know, if we looked at studies, and I think your book has some examples of that, studies of parents especially fathers that talk differently to daughters than they would with a son. Okay, it might be more sensitive. They might be a little bit more sensitive to their daughters as opposed to their sons. They might have some kind of gender expectation for them to be tough and play with trucks and that sort of thing. As we're learning, and again, we're just starting to scratch the surface on different cultures and different ways of thinking about things. We're right in the middle of a gender movement, right? We're starting to see different gender identities, people that identify as certain genders over one, or something non-binary, right? Because prior, again, 30, 40 years ago, it was just male and female. Now we have different ideas of what that means. We may have a male that identifies as female, or a male that identifies as non-binary, for example. Okay.
Yes.
Go ahead.
You said that because it was a girl, it cannot be playing with the cars.
Right. That might be like an expectation that the parent has, and especially, I mean, with this transition that I grew up in that era.
Well, I know. No, I just play with cars, baseball. My cousins are male.
Okay.
So
Okay.
I have more male than girls, so at my age. But with my kids, I did differently. And with my nephews too. I have one that play with the Barbie, and my husband comes and say, no, it's a boy, he cannot play with the Barbie. I say, unfortunately, baby, you have to let development. He decide what they want when he's older. Let it play, because he see the girls playing, putting clothes to the Barbie, so he want to put clothes to Ken.
Okay.
You know what I mean? And he has Down syndrome. He figured out that girls is playing there, and his brother is playing too. So he will pick one. And my husband say no. I say, we know in the area. And I grew up playing with boys and with girls, and I never changed my sex. So don't come with that things in your mind, you know?
Yeah. No, and that's very, very important. And prior to that, I had this conversation with my parents, because we grew up in a pretty traditional household, but there were situations like that one of us would want to play with like what was it, Rainbow Bright, I think, was a Rainbow Bright doll or something. I was just fascinated with the colors, but I remember at a young age being told, don't play with that. That's my cousin's. Boys don't play with those sorts of things. And granted, it probably didn't stunt me developmentally, but I can see how that would stunt somebody. Like if a child wants to play with something, because again, we're little explorers, we're little investigators. We want to build up our minds in a certain way. And children that are told that they can't play with something because it's not their right gender, could be damaging later on down the road. And like I said, I was okay. It didn't stunt me or create any kind of anxiety or depression later on. But if you can imagine, especially with an authoritarian parent, that could be very, very damaging later on in life for that individual, especially if they're encountering some kind of gender.
I remember hear adults saying, even if a man start talking with the hand, that's normal for me. But they say if he start using mannerism, he will be a gay. I say, why do people think about that? It's just another way to communicate. Period.
Yeah.
You know what?
And what about I would say probably one of the biggest fears growing up is that children that are different tend to encounter what in school? Bullying, yeah. Judgment, right? Criticism, right? So that's a fear that many parents have, is what if my child is different and they're in the school system and they're picked on? I mean, what's the right answer to that? I don't know. There is that fine balance of allowing them to be themselves, to what end? We don't want them to encounter some kind of harm later on. So there's that balance of teaching like social appropriateness and that sort of thing, and also allowing them to explore whatever it is that they want to explore. So like I said, there are different schools of thoughts on that. I know I'm kind of going off on a tangent here again, but these are important things to understand when we're teaching language and helping children to develop those language skills. Is, watch the gender related. Joe talked about just using, you kids and as far as you girls, and that's something I even have to adopt in my classroom. Instead of, it's very easy for me to say, all right, you guys, you guys do this, or you ladies do that. We're not in that world anymore where we can assume that people are comfortable being assigned certain gender names, right? So doing that earlier on and watching our gender related speech is not only good practice for us, but it's good practice for children growing up. Okay, and we are kind of on that precipice right now where the Generation Z gets it. I'm Generation X, so I've got a little ways to go. I've got some learning to do. Okay. Some characteristics of the language that we look at are phonology, morphemes, and semantics. So phonology is just very simply mimicking language as we hear it. So if a child hears ba, they're going to start to create that. They're looking at your mouth, they're hearing the sound that's coming out, and they're going to do this trial and error. They're going to try and figure out a way to make that sound, because again, their goal is to connect with you. They have certain needs and certain motivations to getting things from you. So they're going to try and mimic you the best that they can, either for food, for comfort, or to take away some kind of discomfort. All right. So that's the motivation behind them trying to mimic what they have. Once they start mastering mimicking with either through sound or through watching you, they'll start to use what are called morphemes. And morphemes are assigning a meaning to that. Okay. So ba might mean a bottle. Da might mean dad appears. Ma might mean mom appears. Okay. Whatever these certain, they usually start out with a hard consonant and end in a vowel. And then that evolves much later into maybe reversing or adding different sequences, but morphemes are assigning the value to that. Semantics are certain rules that we have, and semantics come on a little bit later when we understand what sentence structures are. Okay, so I want ba, for example, we're starting to understand that there's a verb and that there's a noun in there, and being a little bit more elaborate. So that's through the use of semantics. Okay, and here's a cool little chart that many of you can either use or but it gives you an indication of what age speech comprehension and speech production should occur. So on the top one, you see the vocalization and speech. So right earlier on, right about a little after 1 to 2 months, we're going to start to see one syllable. Okay, that's going to be the ba, the da sort of thing. And it may not necessarily have any kind of meaning to it whatsoever. They may not understand what they're doing. They're just mimicking because they're wanting to connect. After about 2, 3, going into 4 months, we're going to see cooing occurring. Does that say cooing or cooling? Yeah, okay, cooing. It shouldn't be cooling. So cooing is occurring. This is non-directed. This is something that they're just exploring with their mouth. They're not necessarily repeating anything. They're just developing their own abilities. They're wiring what's coming out of their brain through their mouth just to see what their abilities are. So this is kind of like an exploration. And we see that develop into babbling right around 4 months of age, where they start, they may not even be talking anything sensical. They may not actually want anything. They're just stringing a bunch of syllables together to just for the purpose of making sound and explore how their mouth works. And then we start to see right around 6 months, we start to see clear vocalization, more purposeful speech. Okay, more purposeful babbling, just trying to again gain something. And then after about 7 months, that's where we start to see them start to put syllables together and then say first words into about a year. And again, sometimes kids are either delayed for whatever reason. In my daughter's case, she was kind of suppressed by my talkative son. My son just babbled and talked, and they were very close in age, but she didn't need to talk because he did. But once she started talking, I mean, it was just in clear sentences at around, it was a little earlier than 2. But anyway, so this just gives you pretty much a
Professor,
good, yeah, go
by
ahead.
any chance, your son don't talk for
What's that?
your daughter? Like my daughter, my oldest daughter used to talk for my son until I stopped her because she always talked for him.
Okay.
Yeah.
So your question was, what was my son an early talker?
Yes, it always talking for her, or was just because he talked too much?
Yeah, he just talked too much. I mean, he was just he was just a rambler. I mean, he just rambled on about everything and anything. And even today, you know, he probably gets it from me. You know, we're able to just talk in circles around each other. But anyway, yeah, I think looking back, I think she just watched him. That's all she wanted to do. She just wanted to watch him talk and see what he could get out of things. And she just kind of laid silently and watched him do his thing. But now, yeah, and they grew up today, and they're great friends. I mean, they were thick as thieves growing up, and they continue to be. In fact, we joke around. Anytime they get together, they get into trouble. It's not a lot of trouble, but they'll do silly little things together. But yeah, she definitely didn't have to do much because he did all the talking for her. So anyway, yeah, fun little thing to watch your kids grow up and do. Let's see, early sounds and communication. We talked about this a little bit. Just the exposure to speech and sound is very important, because if they're not able to reinforce that language earlier on, then that could lead to pro-social issues later on in life, or later on in their childhood, if they don't develop that environment. And that could happen for many reasons. It could be lack of education for the parents. It could be that both parents are working. You know, we like the idea that both parents are present and both parents are focusing on children, but the reality is, and unfortunately, you know, maybe some of you know this, or you know somebody that's been that is going through this, is you know, society has different plans sometimes. You know, if both parents have to work multiple part-time jobs, that doesn't leave a lot of room for children to grow up in a learning rich environment. Okay, so that's important to understand. So how do you combat that? What are like, if you know somebody, or if you're working as like a caseworker, a nurse, or an educator, and you know somebody that that has a child that's they're too busy either working or whatever. I mean, what advice do you give them to help them with that, with developing their child's talking ability and learning ability? Is there any right answer to it? I mean, it's easy for us to say, right? It's easy for us to say, you know, have more toys for your kids, spend more time with them. But the reality is sometimes that can't happen. So,
Well, the small time the parents have after come from work, they can use that. It's better a little bit than nothing.
Yeah, yeah.
And my sister-in-law used to do that with the kids, and the kids, they have a good talking and everything. Yes, I babysit them, but even that I help them, they have that small time for them, but the kids remember everything.
Yeah, yeah.
It was very good for them.
And I would like to say, you know, I've spent a lot of time in the field and a lot of time with parents who don't get it. It's not necessarily they don't get it. They haven't been exposed to a learning rich environment themselves. They haven't been exposed to an environment that's compassionate. They may have grown up hard lives, and they want their kids to learn how they learn, because that's what we do, right? We want our kids to follow in our footsteps and learn how we learned. And sometimes that's not always the best option, especially for children that are raised in poverty, right? There's a lot of subcultures that don't want outside interference until there's a clear problem and their kids are punching holes in walls, and then they come and they want help, and that's the unfortunate truth to how we deal with it. And it's not necessarily their fault. Some parents just don't know better, and it's hard to educate somebody who doesn't want help with those areas. So that's just some of the challenges that we face as clinicians and as healthcare providers, is trying to get help to the people that don't actually want it sometimes. But in an ideal world, it'd be great if we had children that were around infant directed speech and stuff like that. But the reality is that this just doesn't happen.
It's not put Sesame Street. That's a wonderful one.
That's right. It's not all Sesame Street. All right. So I'm actually going to, I know I'm flipping through slides here to see if there's anything important I need to cover. We are running up on time here. Were there any questions on intelligence, on development of speech, anything like that? Any questions or comments or anything?
I don't have a question about that, but I did have a question about assignment 4.
Assignment 4. Okay, what's your question on that?
So there's like case studies in there, and I know we used the case study for one of the other assignments. And I just wondering if we're using those or if we're going off of what it says in the Dropbox.
Yeah, just go off of what it says in the Dropbox. I tend to put case studies there in case you want to read them, you want some reinforcement and some extra support. Sometimes I'll use those, if I have time, I'll use those as a classroom exercise. Excuse me. And sometimes I'll use those as a means for like back up the assignment or something. But yeah, for this week, if you see the case study in there, don't be alarmed. It doesn't necessarily mean anything's due. I may use them, I may not, but just follow along with what the assignment says. Okay.
Okay, thank you.
Yep. Any other questions?